Hello, my name is Haley Parr. I'm a registered nurse working in the community. Welcome to the BCIT course, Breastfeeding Experience Theory. You will learn about infant tongue tie and blocked duct in breastfeeding. You will also learn about signs and symptoms, as well as the challenges for both mother and babe. This is according to the Situated Clinical Decision-Making Framework. Let's look at an example. Hello, and welcome to the Public Health Unit. I am Nurse Haley. How can I help you?
Hello, I am so tired and I'm worried that I'm a bad mother. I'm having so much trouble feeding my baby and he is so upset. Wah, 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 wah.
Can I look in his mouth? Oh, it looks like he has a tongue tie. Do you find it hard for him to latch onto your breast to feed?
Yes, it is very difficult. My breasts are very sore and it hurts so much when he latches on, but he does not stay. I almost don't want to breastfeed anymore. I am worried that he will stop growing. I'm worried that we are not bonding.
Can I take a look at your breast to see if there is a problem? I also see that you have a blocked milk duct.
Oh no, what am I supposed to do? Can you help me?
Let's take a look at some of the causes of tongue tie and blocked nipple ducts, the effects on the mother and babe's health, and the role of the nurse to help with breastfeeding. Let's look at the knowledge component of the framework. A tongue tie in an infant is defined as a cord that stretches from under the tongue to the floor of the mouth. In infants, this can cause an ineffective feeding latch and leads to many breastfeeding issues. Many things happen when a child feeds. The infant needs to open the mouth wide enough to allow the tongue to protrude forward, past the gum ridge, and take a big mouthful of breast. This warrants that the milk sinuses are massaged by the movement and pressure of the tongue and causes the milk to release, which then ejects through the nipple. As the tongue protrudes over the gum ridge, it protects the nipple from being squashed and damaged by the gums, which causes pain for the mother. The movements of the tongue also stroke the breast and draw the milk out to maintain the flow. The nipple will elongate, pointing down the babe's throat. Effective tongue movement and sucking will empty the breast. When a newborn has tongue tie, the movements of the tongue are restricted and do not allow for the mouth to open enough, which impedes effective latching and sucking. A tongue tie can also lead to complications including inability to latch, poor sucking coordination, inadequate nutrition, low milk supply, failure to thrive, dehydration, sleep deprivations, and problems introducing solids. A blocked duct in a mother's breast can result from a newborn having a tongue tie. A blocked duct happens when the breast is not emptied and the milk is not let down. The tissues around the milk duct get inflamed and swollen, and the milk gets clogged. Having a blocked duct is very painful and can lead to complications including mastitis, which is an infection in the breast, discontinuing breastfeeding, and inadequate nutrition for babe. Some cues for tongue tie and blocked duct include, in the infant, poor latch or difficulty getting a latch, poor sucking coordination, chewing sensation, tired, low weight, vomiting and gurgling, and prolonged dribbling. Also, as a nurse, you want to assess the tongue and the movements of it. There may be a heart shape to the tongue. It is important to assess for dehydration, failure to thrive, or malnutrition. Cues to look for in the mother include painful feedings, swelling in the breast, localized swollen area or lump, decreased blood supply, or hot sensation. A nurse wants to look for abnormal lab work, Take a set of vitals and see if there are vital changes, and looking for signs and symptoms of systemic infection, including fever, flu-like symptoms, or redness. After an assessment, it is time to use judgment to decide on the priorities for this client. We will look at 3 basic and important rules of breastfeeding. Priority number 1 is to feed the baby. The most important aspect is to make sure that the infant is getting proper and appropriate nutrition. Priority number 2 is to move the milk. This is a very important rule for this dyad as it will help to treat and prevent the blocked milk duct. Priority number 3 is to help the infant and mother dyad learn to breastfeed. It is important to encourage and empower the dyad to exclusively breastfeed. We are going to make some decisions with the dyad and educate about solutions to the problems. Priority number 1 is to feed the infant. In times of difficulty breastfeeding, it is important to keep bringing the child to the breast to stimulate milk production. However, there are times when interventions are needed so the infant can have proper intake. Some ways are hand expression, pumping, and the delivering expressed breast milk through spoon feeding, a syringe in the mouth, or a bottle. Another option would be a supplemental nursing system. Priority number 2 is to move the milk. For this client, there needs to be some strategies to help resolve the blocked milk duct. Always remember to bring the babe to the breast to help milk stimulation. Use warm compresses on breast before and while feeding. Massage the breast towards the nipple to help let down the milk. Hand express between feeds. Avoid restrictive clothing and underwire bras, and alternating positions of feeding. And putting the chin of the babe to the blocked duct will help. A cold compress on the breasts between feeds will help too. Priority number 3 is to help the dyad be successful in breastfeeding. Constant assessment of proper nourishment of infant. Teach the mother signs of dehydration and inadequate intake. Also, teach the mother signs and symptoms of infection in her breast. At this point, it is time to see the physician about surgery to resolve the tongue tie, which is referred to as a frenotomy. Evaluation on the decision and strategy is needed. As a nurse, you need to ask yourself some questions. Is the infant getting enough nutrition? Is the milk moving? Is the dyad breastfeeding? How is the psychological state of the mother? Is surgery necessary? If the infant had surgery, a nurse needs to make sure all of the evaluations questions mentioned previously are answered. If a frenotomy is performed, then reevaluate the breastfeeding experience. Remember to check the surgical site for any complications, including bleeding, redness, swelling, or discharge.
Thank you for watching my video on infant tongue-tied and blocked milk ducts. Always remember the 3 rules about breastfeeding. Feed the baby, move the milk, and help the dyad to breastfeed.
Thank you for all of your help.